Hey, silly. Alive.
Hello everyone. Good evening and good morning. I don't know at present what the time is going on around the world, but because we have different countries in different places. Come from the today we are going to discuss about the dry needling, what is dry needling, and why we are here to learn the dry needling. First of all, I want to show a video, motivational video that inbuilt you why we are just learning this all techniques or why we are going to learn different techniques. Just I'm sharing my screen now for the videos play. Now friends, now the webinar is on. It's just a motivational video. We all are the physios and we have a very challenging uh, problems we face in the market or in our profession in our clinic also. Because the physiotherapy profession is just different. Most of the medical practitioners who prescribe medicines, just think about that. We have no idea and we don't have any proper skills. That's why it's a very challenging profession, physio. In video, we have seen that one person is trying to do some different, just a small one, just to break the stones. And when the work is end, some persons are for appraisal and one person is just trying to say he has not done anything very good. It's a just simple one. I can also do that. But the thing is that to initiate a different thing is very important. No one has power to initiate properly. Um, I'm getting some messages that some of you are not unable to listen. Kindly message me in the chat if you are not, if you are unable to join or chat. Just message me in the chat box. Is it okay with you all, everyone? Now we are starting dry needling. Dry needling is just a technique. It has different myths, different concepts regarding dry needling, how it works, how it can help just needling a person at different places, how we will identify the points where we have to needle it. And we will see the definition of the dry needling. What the dry needling is? Dry needling is a treatment that involves the insertion of a very thin, very thin needle into trigger points or tight muscles of your body. The main purpose is to improve tissue healing and restore muscle function. In our body, there is a lot of problems, and the problem is due to for a specific cause, and we have to find out that specific cause why the problem occurs. In physiotherapy or in different profession, if someone related to osteopathy or some believes in the aura, all have different thoughts, and all persons see the patients on different aspects. But the muscle is just like an elastic behavior. It has restoring feature. Muscle always tend to restore itself. Then whenever the muscle gets tighter, when we needling on that particular muscles, then automatically the muscle function is restored and it brings a patient relief. The principles of dry needling is just to include the patient education and consent, procedural education, and practical applications such as positioning, palpation technique, and aftercare. The principles of dry needling explain that what are the things that we have to come in our mind during the practicing dry needling. The first one I'm describing the patient education and consent. In my clinics, most of the patients come for the first session. They have no idea regarding dry needling, but we have to just educate, or we have to just first ask them, have you ever done the session of dry needling or not? If he is not he has a new experience, he has a new experience of dry needling, then we have to motivate him and we have to educate some things regarding dry needling, how it works, will it be painful, will it be create soreness or not, and after that what should be the care. We have to just educate the patients regarding this. Second is procedural education. We must know have the procedure. Generally we don't ask the patient, and we don't communicate with the patient, but it's very necessary to communicate with the patients so that during communication we can feel the any difficulties or the any discomfort felt by the patients, and it helps us a lot to understand the feelings, to understand the wrong things when it comes to the patient. Because when we are the beginners of any particular techniques, we feel that we feel that uh, we just do mistakes because we are the man and we mistakes. So we have to communicate the patient so that if we are doing any mistakes, then with the communications or the some changes in the voice, we can feel there is something wrong and we can change it. Third one is the most important are the practical applications. As we are all physiotherapists, and one thing is common, we understand in our syllabus that patient should be in comfortable position and the physiotherapist should be at comfortable position. Similarly, when we are going to proceed dry needling on the patients, the positioning is a very important role so that all different muscles have different anatomical structures and the features. In that, according to this anatomical features, we have to create, we have to fix the proper patient's posture. We will discuss in this how the positions, how if we are doing the branding of the upper trapezius muscles or the deltoid muscles, what should be the positioning of the patient, of the therapist, and the needling technique there is. Verbal communication should be ongoing during the dry needling, and clinicians should position themselves comfortably, comfortably, so that no disorders, or there should be no risk of work. Palpation is the more important thing, because we just palpate on the patients that whether uh, it is a trapezius or something else. If we are doing trapezius muscle, upper trapezius muscles, there is very much differences between the upper trapezius muscle and supraspinatus muscles. So we must have to we must have know the correct palpation of the muscle, so that we are, when we are doing the dry needling, we can go on the right muscles or targeted muscles. During the palpation of the muscles, we use the pincer grip techniques. We use the pincer grip techniques because if we are the beginner of the dry needling practitioner, then if we are just needling the needle directly, sometimes maybe it can go deeper. So that to avoid this complication, to avoid this mistakes, first we have to just grip the muscles so that unnecessary or the needle cannot go deeper, and we are in the safe hands. And we have to also ensure the patient that the muscle is relaxed before starting the dry needling procedure. Muscle should not be in tense condition. So sometimes the patient is so panicked during the dry needling sessions, and we are seeing that the patient is so panicked and he has just tightened his muscles. In that case, we should not have do the dry needling. Um, should we understand if we are going for the dry needling process, then we must have knowledge about the anatomy. If you don't have the knowledge anatomy, then it's maybe some kind of risk. So you must have to know the anatomy of the structures, of the muscles, of the ligaments, of the tendons. Which structure we are targeting, it depends on, so that we can do safely, depending on the patients. Now we'll come we will know about the equipments required for dry needling. What should be the equipments? If you are going to process dry needling, we have needles, gloves, hand sanitizer, alcohols, wipes, needle disposal box, cotton swabs for blades, and a waste disposal bag or can. These all things are needed for the dry needling process, because we must have to be sanitized, as it's a COVID area or just before the COVID era, it's going to be under protocol. A hand sanitizer is got, so that no infections, no kind of infections can harm us. Alcohol wipes is just to clean the skins, so that if the patient comes from the distant part, and they have just some sweatings on their skin, then we must have to clean up that skin, so that when we are needling, no infection, no chance of risk can be there. Needle disposal box, there is that, so that disposal should be safe and can be clean environment in the clinic also. Sometimes when we needle the patient, bleeding occurs. Then we have to just we have cotton swabs to wipe up the bleeds. And sometimes also it occurs out that the needle got fractured, needle get break. In that condition, if you are doing dry needling on the patients and needle gets break, just remove as soon as possible, because the alignment The correct direction, the incorrect direction of the needle can harm the patient. If I have completed the dry needling session to the patient, what should be our care after care? The muscle and treatment needle should be compressed immediately following needle withdrawn for homeostasis for 2 up to 30 seconds on until any bleeding has stopped. The cortisone may be used and should be discarded as appropriate. After if the bleeding occurs, then we have to swab or we have to put the cotton there up to 30 seconds. We are just putting the cotton over there just so that homeostasis fix process can be start and the patient can no harm. If a blood is present on the skin, it should be cleaned with an alcohol swab, which will be discarded as appropriate. The patient should be educated on aftercare, which may include remembering as a gentle stretching, the use of hot packs and waters. Sometimes the patient's bleeding, patient bleeding is not stopped. Then at that condition, we have to do something else, or the patient feels some tender pain after needling, then we must have some other things so that of just like a stretching exercises or the hot or cold packs we can use. I generally use cold packs and the stretching one, because the most effective. Third one, in it, adverse reactions should be dealt with as noted in the previous sections. Adverse reaction depends on the condition of the patient and the procedural of the dry needling, how we are proceeding the dry needling sessions on the patients. The most important things now we are going to do that how dry needling works on the patients. Just just we are pinching the needle and the patient gets the relief. How it's possible? Those who don't do the dry needling, they have no belief in the dry needling because they don't know like how the needling just gives the relief to the patients. First one, the mechanical effects. Whenever the needle goes inside the muscles, there is a micro bleeding releases that release the fetus and just increase the growth factor just by promoting healing. Chemical effects is that the needle depolarizes and neutralizes abnormal chemicals at motor nucleus, resulting in improved symptoms. And electrophysiological effects is that we do the needle in a spontaneous electrical activity improved at the motor end plates or neuromuscular junction with granule. Then to create or to target, if you are targeting for the electrophysiological effects, you must do the granuling on the neuromuscular junctions. Neurophysiological effects, it inhibits the painful neural pathways, activation of the descending inhibitory systems, which blocks noxious stimulus from the pain neural pathway. It also works on sympathetic nervous system effects as it activates opioid-based pain reduction. It helps by the sympathetic nervous system also. Brain handling also works in the neurological conditions like the paralysis or the some other cases also. Brainstem effects. When we do the brain handling, it activates the non-opioid pain relief via serotonin or norepinephrine from the brain stems and just improve the healing power of the first patient. Pain effects, it reduces the painful input from trigger points. Then we have to learn about the trigger point, something that how do you know about that on the particular muscles. This is the only the trigger points. How will we know? We will discuss during the techniques. Dilating resolves sensitivity to pain and normalizes nociceptive channels. Inflammation effects is that dilating also triggers the systems that control inflammation and decrease pain. Before starting indications, branding, I want to share you something that some persons think that dry needling is different. Some persons say that dry needling and acupuncture are both are same. What is the correct answer? So according to my view, it's just on the depends on the thoughts. What you think. Brand handling is work on the specific soft tissue structure. There is no concepts of aura or energy. If you are doing acupuncture, the acupuncturists who are the acupuncturists, they believe on the aura. They believe on the systems or the particular points on that creates that increase or decrease the aura of the different organs. And that manner, the acupuncture and brand needling is different, but about just the needling process is same for both practitioners. Now we come to the indications. Dry needling is used for pain and dysfunction of the musculoskeletal system of various origins. Dry needling is used mostly for the treatment of myofascial trigger points. Further indications are among several others. For example, insertional tendinopathy, scar pain, soft tissue pain, and tension muscles. Now, generally, we believe and we know that dry needling is going to be done only for the stiffness or just to release the muscles, but it's not necessary. We do the dry needling in the both cases. If the muscle gets tighter, if the muscle gets looser, in both cases it works. For the it just increases the healing power. It just increases the healing power, as we have seen the effects, pathological effects, but just bring out bring the changes in the body when we need needle blood inside the body. It's very easy to understand or learn contraindications. Cons- Contraindications always in the very some diseases or some points and rest of all the indications. First one, the acute systematic infections with or without fever, all acute emergencies, anticoagulant and coagulant dysfunctions, no explicit consent from the patient, paresthesia, lymphedema and condition after lymph node removal, increased risk for infection, change of the skin, tumors, hematomas, osteosynthesis and joint replacement, implants, pregnancy. These all are the contraindications where we don't have to go under branding. Now about the branding techniques. We are just representing yourself to yourself about a few muscles, the branding techniques, and we provide you all videos of the needling technique. But because it's not possible to learn you proper by positioning the patient on patients during the dry needling sessions. Dry needling sessions. Uh, this is there is a I will also provide you the notes about the dry needling. PPT also will be given in the group and some videos or some notes also there. And the first one is that when we either we do the dry needling, there should be proper directions. For just example, take the example supraspinatus muscles. The patient should be prone, palpate the areas of the pain. The needle should be inserted near the supraspinatus fossa, and the direction of the needle should be the greater tubercle of the fingers. And the then you can use the needle about between 1 inch about 1.5 inch, and the duration of the needling is just sometimes 10 to 15 or 20 minutes maximum. We can leave needle on the patient for 20 minutes also. And infraspinatus, just the same thing. Just we have to feel the pain areas, and the perpendicular direction should be the row. But the perpendicular direction towards the scapula is that, and the needle size is the same, 1 inch to 1.5 inch. Deltoid muscles, the patient should be side half sideline position. Ideally, you can do in any way. It depends on the muscles whether you are going for the deltoid, either anterior, medial, or posterior. We have mentioned it on the videos. Which position I got. Subscapularis muscles, the patient should be in supine position, and similarly, the needling technique should be in supine position, and the needle size should be 2 into range, upper trapezius, and so on. And we just provide you all the things in the notes. If any questions you get, you can give me the on my personal message WhatsApp so that I can satisfy your questions. And the most important thing is that if you are doing dry needling, And needling techniques is divided into three types: perpendicular direction, oblique direction, and inferior direction. But in most of the muscles, we do the perpendicular directions. Some muscles we go for the oblique, or some muscles we go for the inferior directions. That's it. In the next webinar, you will get the clinical dynamic. Yes, we will talk about the conditions of the cases. We will and ask about the cases in particular cases. If a patient comes about the osteoarthritis of the knee, then what should be the needling points? Where should be needle, and what should be the muscles? We are talking about the clinical conditions on the next webinar. That's an advanced one. The date is not committed. It will be given to you on the WhatsApp group. If you have any doubts or the questions, you can ask. You can ask. Okay, what the questions is there? Is it coming in your mind? If anyone who will have questions, please send me. Okay. See. What are the type of the needles we use in dry needling? Generally, we use the needle 1 inch of the size 1 inch. They should be. It means we have to know the direction of the muscles. It depends on the anatomical structure. All different structures, different muscles have different anatomical structures. Then we have to know the anatomy proper. Then you can understand. I'm just answering the questions whatever given in the chat box. I will give you the notes in the group. In that notes, you will know about the proper directions or the precautionary measures. Screenshot page.